While considering community resilience and the need for systematic change, we are happy to introduce at this time a local initiative called the K-Ready Community. As we focus on vulnerable communities in this crisis, children are among our most vulnerable. In a partnership with our sponsor, the West Orange Healthcare District, our partner, the Early Learning Coalition of Orange County, and Polis Institute, we are happy to welcome Lori Chianese to present the K-Ready Community Initiative. At this time, please welcome Lauren to the discussion.
Hi, everyone. Thank you so much for having me. It's been, you'd think being on a conference call all day would be draining, but I have gotten so much energy from the conversation. I'm just so excited. Rachel, thank you so much for bringing us on and letting us talk. And Dr. Ellis and Mr. Newton, I'm just so grateful to be able to speak after you guys, because you framed it so perfectly, and I'm really excited to work with you guys. So I don't have a ton of time, so I'm gonna kind of jump right in. Hopefully you all can see my screen. So last week, a lot of you probably know this, but last week was the Week of the Child. And I think it's telling that it kind of came and went without a lot of fanfare. And there's just so much going on, and we're all just glued to the news to find out what's going on and what are the changes and how am I going to get unemployment? And it's just crazy. But if there's ever a time that we need to focus on our children, this is it. And so we have to make sure that we are kind of bringing ourselves back to what do we do right now in this moment to respond? But then how do we, as you all said and framed so well, how do we come out of this even better and making sure that our kids are thriving? That's like one of my favorite words, to thrive, because we don't want our kids just to survive or to meet a baseline. We want them to meet their greatest potential. And so I'm really excited to tell you guys about this work that we've been doing. So I'm going to tell you a couple of things. One, a little bit about the project called Becoming a K-Ready Community, which we were getting ready to launch in March, but have had to kind of pull back a little bit. So that's the second thing I'm going to tell you about, is how we've pivoted in this time with the COVID-19 crisis. And then the third thing, briefly, it's just, moving forward, how we're going to be working with Dr. Ellis and Mr. Newton and the work that they've been doing on building resilient communities as we move forward with our project. So this is a model, not the model, and we're learning, and we can't wait to interact with all of you to learn with you. But what I hope is that we can be used as almost like partners and bouncing each other ideas off of each other through this time. So, this is something we've all known in this community, the community of people who are working with children, is that education and childcare are essential. It's always been essential, but it's definitely an underserved and under-resourced network. And right now, this group has really come to the forefront because childcare, especially when our schools are closed, and especially for our young children, the children under 5 that weren't in public schools anyway, has become even more essential. Because without the child care centers and providers, the folks who are essential workers are not able to work. And so these are people who are kind of keeping things running and keeping us healthy and able to get the resources we need to get through this time. And their children need to have a place that's safe that they can go to. And so it's these providers are not just essential, but they're on the front lines, right? Because you can't virtually educate a 5-year-old or a toddler or a baby or an infant. You've got to be there with them. And so they are, risking their own health to make sure that the families who are essential workers can work. And so I think the idea is just that this is something that was essential before has just become like a whole new level of essential now. And, we think about this, this idea of essential, right? The firefighters and the nurses and our emergency responders, we've always thought about them, right? But we have a new definition of essential, which is folks who are putting the groceries on the shelves and making sure that we can feed our families, and the people who are delivering, the masks that we need to go out and do our daily lives. These are people who have now become essential too. So this need for the early care and education system to be there for these people to make sure they can continue doing their jobs is even greater. And then you've got the providers themselves. And so for a lot of you know that providers in our community are mostly small businesses, that about 90% of the early care and education industry in Orange County are small business owners, mostly women. And they're now on the front lines, but they're really struggling. And that's something that we've been really thinking. So enrollment has dropped because so many families are not needing care, but at the same time, enrollment has gone up for those essential workers, right? And so there's this kind of dynamic where many providers are actually having to close their doors because they're at their center, the enrollment is not high enough for them to keep their doors open and keep paying their staff. But so where do the kids go that their parents have to work, right? There's this shuffle happening. And then you've got an issue of being able to get the equipment that you need to keep everybody safe. So providers are often on their own. They're not part of this giant school system with economies of scale. They are one woman trying to, take care of a group of 10 children. And at the end of the day, she's going to 3 stores just to get water, or she's standing in line at Costco for 3 hours to get bleach. And then she gets in and they're out. So what does she do? How does she keep her staff safe? And this is causing a lot of our providers to have to close even when there is need. So in our community, without relief, we're going to see even more providers close. The ones that are, we're funneling the children who do need care still, we're saying, okay, go to this provider, they're still open. But that provider is struggling and they might have to close their doors soon too. And we're finding that about, a lot of providers are closed, and those who aren't getting any sort of support will close forever. And so that has huge impacts on the long-term impact, right? How are we going to recover when our economy opens up again if so many of our providers have closed their doors forever? And so this issue is the early care and education system just needs our support. And so this is something that, we know if we don't address it, it's going to be felt for years. Because, the children, as we've heard from all of our presenters so far, they're so vulnerable during this time. And if we don't tackle this today, there could really be traumas that our kids experience that will be very difficult to address down the road. And so this is something that, again, I feel like I'm showing this slide and you guys are all probably saying, yeah, we know this already. Our community is, I think, particularly vulnerable because of our economy and the way that our economy is based. And we already know that so many of our families, 25%, and Dr. Ellis had shared that earlier, of our children live in poverty, but half of our families are struggling just to make ends meet. They're in this very vulnerable position of being ALICE, right? The United Way, asset limited, income constrained, but employed. And so they're just right there on the brink. And then you've got a lot of other issues. Obesity has been an issue that's come to the forefront in this crisis because so many people who are obese are more vulnerable to the disease and are becoming sicker. And 40% of our children are obese in this community. And then we've got many of our kids, even before COVID-19, put us into this situation, we were struggling to make sure that kids were ready for school. 40% of our kids entering kindergarten already behind when they were 5 years old. And then you see that that issue become even greater by the time they're in 3rd grade, when only half of them are reading on grade level. And so if we do nothing now, things are going to be even more difficult down the road. And that's why we're working to address that. And becoming a K-ready community is an effort to improve the early care and education system, both health and education, because we know a child, doesn't just appear at during the school day or the care day. They are whole people with health needs, and so you have to address the whole child. But we have had to pivot. So right now what we're doing is really responding, and I'm trying to understand, what do the providers need right now to take care of their children, to educate their children, and to make sure that those essential workers have a place to take their kids during the day so they can do their jobs. And so we've been working with a group of leaders, including the Early Learning Coalition and Orange County Public Schools, and what we are calling our ECE Pandemic Response Team. And that's really just figuring out, what is it that we need to do today, tomorrow, this week, and responding to the needs of those people who are on the front lines of taking care of our children. But as so many of us, have heard on the call, it's not enough to just respond to the crisis and then go back to normal, right? And a friend of ours sent us this Chinese symbol for crisis is actually a combination of the symbols for danger and opportunity, right? And so if we stop at danger, we've missed the opportunity to come out of this crisis even better, to build a more resilient community. And so that's why the next phase of this work is to just reset. How do we recover and rebuild better? Once we've gotten out of the emergency, how do we get, cleaning supplies and masks to the people who are taking care of the children? Then how can we start to get out of this crisis in a better place and position people to thrive? And then the final is to rebuild, and rebuilding and really tackling, what was it that we were doing that wasn't working before? And I think this really gets into the work that Dr. Ellis and Mr. Newton do, which is, what are the policies and the systems that are fundamentally broken and have been for a very, very long time in our community that we have to tackle? They're really hard questions, but we have to address them, because if we try to build on a broken foundation, we're just going to tumble, right? And so that's the work we're super excited to be working with Dr. Ellis and Mr. Newton on in the coming months. And they're going to help us figure out, how do we do that? Where do we start? There's so much that we have to do. As Dr. Ellis said, it's not just one magic policy with pixie dust, which I love because I love glitter, but that's just not the reality of it. And so we're going to be working with them to figure out where do we start and what do we prioritize when there's so much to do. So thank you.
Lauren, thank you so much. This is, we're very excited that the West Orange Healthcare District is supporting this work. The Polis Institute, which I hope many of you know about, Polis, they are doing just such phenomenal work in our community, and partnered with this K-Ready community group with Lauren and Leslie, who's not here, Leslie Hartog. There's a lot of promise here. So we just wanted to kind of ask Dr. Ellis, because this is, Lauren has kind of announced to everybody, is that we are going to be partnering with Dr. Ellis and Mr. Newton to advance this work. Because one thing that our network, so we are in this cross-sector network, and you're going to meet the woman who's been leading those meetings here in a minute. And we have really decided in that group, we have talked about the fact that early learning for children, access to high quality childcare and early learning for all children in our community is a critical need. And boy, will it support women and families. And so we have met this team that is ready to move this work. So Dr. Ellis, what do you think? And if your group comes on board to help us, which you are, we're going to be continuing to work with you. How do you see this partnership going? Give us some insight here.
So I'm actually I want to put Harrison in the driver's seat on this one. I mean, we kind of split the work with, there's two halves of this, and you saw that. Even how we frame the conversation, our presentation is, first off, there's that ground building of the coalition. Who are the key members of this coalition? How are you engaged in the community? How are you engaged and incorporating that community narrative into these policy asks, and actually using that to inform the story of adversity in your community. And then once you have that piece of it, then you can begin to hone in on specific policy opportunities. Harrison, I already saw in the questions here about will the ECE address pay disparity for our early childhood education workers? Absolutely. It's not just increasing access to more of our kids to be in pre-K when those pre-K providers themselves are parents. And so we have to be increasing their economic mobility so that not only the education that the kids are getting in an ECE environment are great, but also when these parents go back to their homes, that they're able to provide the stability necessary for their children. So, and there's, right now there's a lot of money that has been flooded into states and locals because of the CARES Act. And so I'm going to pass it off to Harrison to talk about that piece of like how we work with you, not only on the coalition building piece of it, but the policy and advocacy aspect of it.
Yeah. Well, thank you. Yeah. So I'll definitely take that baton on the coalition building piece first, because I think as one of the slides kind of made clear, the process, all of the processes, the four components of the model are always ongoing. We're never done with community involvement or community input. And so, I think always finding the truest narratives, the truest stories of how these policies are impacting people in their lives. There's always more we can do, and everything always begins with listening. So I think that, piece one is to figure out if, there are people we can be in touch with, people you already know, others maybe that we want to be in contact with, to unearth the stories and narratives that relate to the policies I think that you've already begun to identify. Oh, there's a little one. I'm on the phone, honey. Thank you. I'm on the phone. I've got three little ones, three young ladies, and they have minds of their own. So as I was saying. So I think it always begins with community. We would certainly focus on that piece. I think we would also want to be focusing on invisible systems and policies and levers, identifying those things that may not exist in statute, but maybe there should be a statute to impact those levers. And then I think also, the building of a strategy is always certainly something I think is of high value. Is if you have, to whatever extent you have the agenda already, it's how are we implementing this agenda? What is our theory of change that means that this agenda becomes reality, and rolling up our sleeves and figuring out who is it we want to be at the table, what is the timeline we're trying to impact, and how we tactically are going to make that change occur.
Awesome. Thank you, Dr. Ellis, and thank you, Mr. Newton, for your time and all of what you shared with us today. It has been impactful. I think we would all say that.